Hi everyone, my name is Audrey Toscano and I will be talking about the problem of food insecurity in the United States for the Problem Analysis Solution Project. First, what is food insecurity? Food insecurity, defined as a lack of consistent access to enough food for active and healthy life, is a significant problem in the United States, which became even worse during the COVID-19 pandemic. According to data from the U.S. Department of Agriculture, 13.7 million households, or 10.5% of all U.S. households, experienced food insecurity at some point during 2019. This data represents approximately 35 million people who could not get enough food or know where their next meal would come from. During the pandemic, the percentage of households that experienced food insecurity rose to 23%. Food insecurity is a complex problem, and there are various factors that contribute to it, such as where one lives, race, low income, and disability. Food insecurity hits some communities harder than others. According to USDA data, the percentage of Black, which is 19.1%, and Hispanic, which is 15.6%, groups with food insecurity are much higher than white Americans, which is 7.9%. The rate of food insecurity is more elevated in households where income falls below the poverty level. Those without a high school degree experiencing food insecurity is 27%, versus college graduates at 5%. Also, those with disabilities not in the workforce experience food insecurity twice the rate as those without disability. Location can also contribute to people experiencing food insecurity, as it can be more difficult to obtain food where they reside. For example, some may lack a vehicle to get food, and groceries tend to be more expensive. Food insecurity in families with children can negatively impact their physical and cognitive development. According to the USDA, families with children are 1.5 times more likely to experience food insecurity, representing 13.6% of households, which account for 5 million children. In June 2020, according to the Brookings Institution, the number of families with children who experienced food insecurity rose to 27.5%, representing 13.9 million children. Southeast states are among the highest rates of food insecurity in the country. In North Carolina, it is one of the top 10 states in that country experiencing food insecurity. Many in these states live in neighborhoods known as food deserts. Food deserts are usually found in low-income communities which do not have supermarkets. The better supermarkets with more nutritional and healthier foods are found more in the country's affluent areas, but more specifically in North Carolina. In Burlington, North Carolina, there are countless fast food chain restaurants, which dominate other smaller and healthier food businesses. The lack of healthier options and more fast food availability contributes to poor health, tying into food insecurity. To help those with food insecurity, the federal government provides food assistance for low-income individuals through the Supplemental Nutrition Assistance Program, also referred to as SNAP. SNAP is also referred to as food stamps, and households receive, on average, $129 per month. This aid from the government falls far short of meeting the needs of food insecure families. School and child care providers and centers provide good help to reduce household food insecurity. However, many households rely on school and child care provided meals for their children, and for those experiencing food insecurity, this is their child's main meal of the day. With schools and child care shutting down for numerous reasons, this becomes a problem because some rely heavily on those meals provided by both. In North Carolina, 1,456,200 people, which is 1 out of 7 people, struggle with food insecurity. Of those, 38.8% of households getting aid from the SNAP program have children, which translates to 1 out of 5 children experiencing food insecurity. The cities in North Carolina with the most significant food insecurity are Asheville, Greensboro, High Point, and Winston-Salem. Since there are universities in these specific areas, the schools and their students can help those around them. With their involvement and support, they can pick up from where the SNAP program falls short. The most direct way to help households obtain essential food is through community food banks. I witnessed firsthand how practical this approach is. I myself volunteered several summers for a food bank run by Homefront, a charitable organization in Lawrence Township, New Jersey, whose mission is to lift families out of poverty. By going to Homefront weekly and bagging groceries for those in need, not only benefited those who were getting those grocery bags, but it also made me have a great feeling of giving back to my community. Since I care deeply about those around me, it made going to Homefront enjoyable, as I knew those who were receiving those groceries would be thankful and appreciative. Not only was I volunteering at Homefront, but several other people in my community would bag groceries and transport them to families in need, which was gratifying to see. With many other volunteers providing grocery bags filled with weekly grocery items, fresh poultry, and seafood, it produced more bags, allowing more families experiencing food insecurity to have access to them. It was not difficult to obtain these groceries, however, I ran several food drives to keep our shelves complete with the necessary grocery items. I believe if each community had a food bank, there would be a direct impact on reducing food insecurity in households. Not only does food insecurity affect families with children, but families in general. It is especially important to consider the elder who deal with this issue as they can have a harder time accessing food banks. For the elderly and the disabled who cannot physically come to the food bank, the option of delivering groceries to them would be beneficial. I propose that high school and college students with cars could volunteer to drive and provide food to them, or, in urban areas, take public transportation if necessary. Universities could also play a significant role by encouraging students to volunteer at food banks as a part of a community service requirement. As students witness firsthand and see the faces of those with food insecurity, they may remember them later in their careers. It is hard to believe that the U.S. has a problem with food insecurity, as we are such a well-off country. As a wealthy country, there is so much food produced and wasted, so why can't we get the food before it is demolished to those who need it? In America, most households that experience food insecurity live in poverty or have had something happen to them, such as medical expenses or employment loss. Thus, they cannot cover the cost of their food. This cycle is vicious. This issue of food insecurity is not a problem that can be solved overnight. Instead, it is a problem that needs to be addressed in each state and that state's counties. Starting small and helping the state's counties facing food insecurity will help the more significant problem. Getting people to learn and understand the problem that is food insecurity is one thing, but getting them involved is another. If every community in every state could provide food to those in need, it would reduce food insecurity in our country. Thank you.